My name is Inge van Balkom. I'm a child and adolescent psychiatrist and an adult psychiatrist. And I'm very happy to be at this round table to discuss things like stigma in the workplace. Thank you.
Hi, everybody. Good morning. I am Cara Lord. I am a lecturer within the Faculty of Education and Humanities at the University of Guyana. I am also an occupational psychologist. I have a master's degree in work and organizational psychology, and I'm currently doing my doctorate in leadership and innovation. I am so excited about the opportunity this morning to talk with you about issues around stress and health, mental health, and well-being in the workplace.
That's wonderful. Okay. Hi, I'm Megan Ryan. I also have a degree in organizational psychology. I also have education and experience working in mental health, so I kind of understand both perspectives as well. And I work with Dr. Hoven's group, and I have been working also very closely on several studies that we do that we look at different populations where there are high rates of stress on their jobs. So interesting to kind of talk about this topic as well. All right, so I'm gonna share my screen here. I just put together a few slides. So I put together a few different topics here to talk about today related to mental health in the workplace. Obviously, if we have Inga and Kara with some other things that they would like to discuss, that's totally fine. I was just kind of looking generally at mental health in the workplace and the impacts. So when you look at work, so this says work is, but this means mental health issues. So mental health issues are one of the 5 leading causes of disability worldwide. This is from a World Health Organization report from 2000. So when you're looking at disability, that is directly impacting work because generally it reduces your ability to work. And about 15 to 30% of workers will experience mental health issues in their lives. So in the US, 4.5 million adults are considered seriously mentally ill. And the consequences of those mental health problems for workers include work performance, high rates of illness, absenteeism, work-related accidents, and employee turnover. So when you're thinking about things from an IO psychology perspective, a lot of times you have to think about the impact on organizations. So in general, investing in mental health is very important because it is costly for organizations to have employees who are experiencing these problems because it impacts directly the organization because you are losing productivity from your workers in terms of poor performance, absenteeism. Those are very costly things for an organization. So organizations should be invested and wanting to improve their employees' mental health. And in general as well, depression alone causes 200 million lost work days per day in the US. So employers are losing money and it's something that they should be concerned about and invested in their employees' mental health. So this is looking at the cost of occupational and work-related diseases on employers. So mental disorders bring up a chunk of this as well. So we want to kind of look at the ways that we can fix this and make sure that we're not losing individuals to disability and that they're able to be productive members of society. Okay, so there's different costs of disability. There's the direct costs, which is welfare services and treatment. So that's things like disability benefits, need for medication, etc. There's the indirect cost, burden on others. So high rates of mental illness cause other individuals to have to usually care for this person. So that's the role of carers, which we're also going to be discussing in different. There will be a talk about carers coming up as part of this presentation. In addition to that, we are talking about opportunity costs, so lost income, lost contribution to society as well. So the workplace is actually beneficial to people's mental health, which I thought was very interesting when I was reading about it in the WHO report. So we're looking at things like time structure, so that could be beneficial to have a schedule in place. So for example, a 9 to 5, so you know that you have X, Y, and Z in your day, and that could be good for your mental health, establishing your routine. It provides social contact. So I think a lot of people have coworker friends that they've made at their jobs, and that is positive because it gives you another support network. There's collective effort and purpose. So there's the ability to kind of have your calling, as people say, and it gives you a sense of yourself. So I know something that we talk about a lot in terms of social identity. When people are doctors, a lot of times it's a very strong part of their identity, and the same thing with lawyers, things like that, different professions, professional professions. And just the regular activity of going to work can also be beneficial as well. However, there's areas of work that can be stressful, and I think that's something that Ingo was mentioning as well. There, especially in today's climate, due to the fact, for instance, that we're all on Zoom a lot of times because of COVID, there's all of these problems that come out from work as well, because it's an additional stressor sometimes for people. There's overwork, there's unclear deadlines, unclear instructions, conflict a lot of times at work that you have with coworkers that can impact your mental health as well. So it can be a job stressor that can also cross over into your family or personal life. So something that is kind of interesting about work is it can be both beneficial and it can be damaging as well, because if you are under a lot of stress at your job or as a result of your job, that can cause crossover strain and stress that can impact an individual even further. So one of the studies that we work on in New York is the first responder study, where we look at first responders on 9/11 and the impact that experience had indirectly on their families and children. So I think that that's interesting because people don't really think a lot of times about the indirect impact that a parent's job has on the child. But for these parents, a lot of whom are police officers, firefighters, EMTs, they're experiencing very high levels of stress oftentimes at their job. So if they're experiencing very high levels of stress, they're bringing that home in a lot of ways, and that's impacting their children. So that is something that is interesting to look at and try to understand. I know that within Guyana, there's a lot of different forms of employment. So that's something that we can talk about and discuss later as well. That can also be high stress and can be impacting families at home and relationships. And that can be a circular relationship, because when you're stressed at home, that carries over to your home life, that can cause stress in your home life that carries over into your workplace. So there's also that issue as well. So the workplace can also be a good area for prevention. So there's a lot of opportunity to educate and raise awareness about mental health issues. And it's also people struggling. We can use the workplace to promote healthy habits and coping treatments, and it provides individuals potentially with another source of treatment options. So I just gave a little example of a way in our organization, so the New York State Psychiatric Institute, a system that we have in place that we use to kind of help employees deal with mental health issues. So that's called an employee assistance program, or an EAP. And that is kind of a method for our organization to directly provide counseling for different issues such as alcohol use, substance use, and mental health issues, as well as external stressors. So childcare, elder care, financial problems, legal problems. Because there are all sorts of external stressors that can be impacting a person's mental health and therefore impacting their work. So an organization can and does have the ability to step in and say, I can provide support for you for these areas, which is a really wonderful thing that organizations should understand is crucial, because an employee is essentially the way that you make your money for a lot of organizations, and you want to make sure that your employees are effective because it is your investment. So this is a way that employers can provide investment in their employees and make sure that they're taken care of. Okay, so this is one example of a program that we have in our country. So I wanted to open this up now to other speakers and to ask, do you have similar programs to support your employees and their mental health in your countries? And also, if you wanted to talk about any of the other issues that I raised that could be connected with work and mental health. So I don't know, Inga or Kara, if you guys want to take over at this point.
Yes, thank you, Megan. I think one of the important issues that connects to whether the programs in the workplace are effective is about the visibility of a stigmatizing attribute. So the key factor in how it influences a person's social identity. And this is something that in the Netherlands, where I work, is an issue in the workplace. So on the one hand, there are supportive programs, usually from within the organization, but at the same time, there is a high level of perceived stigma from the perspective of the employee with a mental health condition.
And I think, so I just actually went to a talk with Dion Frank, who's a social worker here, and it was really informative. And one of the things she mentioned that's specifically an issue in Guyana is just that, is stigma. So I don't know, Kara, if you want to talk a little bit within Guyana, because Inga is saying about the stigma, if that's something that potentially would also be taking place in Guyana.
Absolutely. Thank you so much. So first off, I wanted to respond at the end of your presentation, because that's something that I'll talk about and touch on when I give my talk as well. I wanted to talk about the fact that organizations in Guyana don't generally take responsibility directly for their employees' mental health wellness. So we talk around things like but simple things like benefits don't actually cover mental health treatment. So it covers physical health treatment, but it doesn't cover mental health treatment. So employee assistance programs that are there to support employee well-being are not things that we generally invest in. And that's why when this opportunity came up to talk at this conference, I said, I have to jump in here. And even though I have other areas of psychology that I focus on, I don't actually have to teach work psychology at GU right now as yet. I know that there is definitely a need and an urgency for organizations in Guyana to focus more on employee mental health and take responsibility for playing their role in supporting their employees. So that's not something that we generally cater to. On a policy level, there are also some bits missing there that I'll talk about as well when after Inga gives her presentation. Does that answer the question, or I feel like there's a second part to that as well that I'm forgetting?
Well, I think, do you think that one of the reasons for that lack of support is because there's the stigma attached to mental health issues?
Right, the other part is the stigma, yeah. Absolutely. So in Guyana and regionally as well in the Caribbean, we tend to identify with the Caribbean more because of our culture and our history, even though we're located in South America. There is heavy stigma around mental health issues. So for example, if I go to a training session, a seminar on mental health and well-being, and I use the term mental health, and I ask the participants, and I've done this, so this is real life experiences, and I ask the participants, what comes to your mind when you hear that term mental health? They'll start to say things like mad people, being crazy, insanity. They'll say terms that are not necessarily positive in nature. And there is a lot of stigma, there's a lot of judgment related to mental illness. There's a lot of discrimination. Even in the workplace, we see that there are some gaps in inclusivity and diversity in the workplace. There'll be issues with discriminatory practices against hiring persons who have been diagnosed with a mental disorder or mental illness, just because of not wanting to have to deal with that stress of, you know, working around this person's, whatever their mental situation is. So there is tons of stigma behind it still. It is something that we continue to try to create awareness and spread the word and teach Guyanese about. I tend to, if I can, I get the opportunity to, I tend to go into organizations and speak with their employees about mental health and wellness and what that means and how that can be framed and looked at in a positive light. But there's still so much wide coverage that that we need to do nationally here.
So Inga, did you want to?
Yes, can I just share 2 slides I made? I have to pick it up. Let's see if the sharing works now.
Perfect.
Can you see something? Okay.
Yep.
I'll go immediately to some discussion points. And the first one I wanted to discuss here is the visibility of the mental health condition, because visibility determines much of the differentness that we experience or perceive within ourselves and others. And sometimes these sources of differences are not immediately apparent. Think about sexuality, for example. And mental health issues can be thought of as concealable differences, you might say, although some symptoms and maybe behavioral manifestations or side effects of medications might become visible or be visible. And this fact also means that differences need not be observable within the workplace, and job applicants and employees might then have a level of choice regarding whether they disclose this information. And this is in itself a source of stress for employees, but it might also determine whether they their beliefs about disclosure can determine how they proceed within the workplace, if it's a new problem or whether they apply with a known condition to a new job. And Brohan et al. Have identified 4 themes within this belief system, belief and behaviors, where he said it's the expectation of being discriminated against, which determines whether there's disclosure or non-disclosure. There are other reasons for non-disclosure and reasons for disclosure also, as well as dimensions for disclosure, which could include selectively disclosing something, partially disclosing, sometimes inadvertently disclosing or becoming of it becoming known that the person has a mental health condition, and strategically timed disclosures. And all these can have an effect on effectiveness of employees within the workplace and the way the workplace can either address issues or help with issues. If these issues are unknown, of course, it's very hard for the workplace to do something about it. And this study had a large part of qualitative information, which was really interesting to read, where people said things like, I don't think you would get the job, you wouldn't be taken on in the first place because you have mental history issues. Every time I get a promotion interview, I'm passed up because they're thinking there's risk involved, she needs so much time off. So all these themes and issues are within the minds of employees. And if they are not disclosed, then obviously the workplace is not, the problem is not necessarily apparent to the organization. So these are the reasons of non-disclosure, which take a large part of the study. People can also say things like, well, it's my private medical condition. If I don't tell anybody, then they don't necessarily need to know. But they sometimes get employees into trouble when they're overwhelmed by stresses at work. But they're also driven by the fear of being treated differently or unfairly, which is some of the things that were noted was I would be passed over for any promotions. And others had said, I don't go out and advertise myself as having a disability. I like being able to keep it hidden. So it's a very complicated issue. If the workplace is willing and has programs for supporting these issues within employees, and the employees choose not to disclose, so they cannot be helped. And this obviously, like Megan already said, has an impact on productivity, but also has an impact on how the culture within the workplace is perceived, whether you are feel welcomed there, whether you're accepted there, whether you're excluded or included there. I guess that's it, Megan.
Yeah, I think culture is very important in a workplace. And if you are part of a workplace where you don't feel supported, and especially when you feel like you're being excluded, that's not going to promote positive mental health. No. And then, like I said, it's like a circular pattern where it's going to negatively impact and potentially impact your performance as well and your productivity. Okay. So Kara, I don't know if you wanted to jump in here.
Absolutely. So I'll go ahead and share my screen, and I will start straight jumping into some of the things that I wanted to talk about. I mentioned earlier that my focus will be looking at stress and wellness, mental health in the workplace. But I also want to tie in some issues that are related to policy that I started to touch on when I spoke earlier. So I'm really happy to go last because I think it would be really good for me to kind of contextualize some of the things in Guyana, which is different from what happens sometimes in the region, sometimes internationally, if we think about Europe and the United States and those kinds of things. And where I'm coming from, the background of my work, even though, sorry, I have some slides up, but I won't always speak to them directly. There's just some things that I wanted to share with you and I wanted for you to see. But there are some ethnographic pieces that I've done, also tied to survey research and semi-structured interview research, data collection. I'm kind of combining to give us kind of a picture of what mental health and wellness that are tied to stress factors in the work organization look like. So I wanted to start by first mentioning, of course, I know that we all know that we spend a lot of our time in the workplace, wherever that workplace might be for us. It's a little bit different now, but pre-COVID, if you think about the fact that many of us were, and I'm speaking specifically in the Guyana context, because I know in some countries, in some organizations, there's a lot of flexibility in terms of work structure, in terms of shift scheduling, in terms of working from home and those kinds of things that existed pre-COVID. But those things were not very normal to us pre-COVID. In Guyana, we were very traditional. We went to work, you work in a physical space. So you share that with your colleagues, with your supervisor, people that you work with. And there's a lot of culture and dynamic that plays into how satisfied you feel with your job, how secure you feel with your job, how committed you are to the organization and those kinds of things. And so we spent a lot of time just commuting to work, spending time at work, getting home from work, and then we spend a little bit of time really focusing on ourselves, on our wellness, on our mental health, on our physical health, doing things that we enjoy, getting involved in activities that are preferential to us. We spend minimal time there and we spend more time around work kinds of issues. And I wanted to bring that up because I find that when we talk about mental health and wellness, we tend to focus the issues in terms of focusing on illnesses or disorders. I feel like it's very some of those issues are coming from. So I have a slide here that did talk about the fact that we could have social factors, biological factors, heredity, genetics, those kinds of things that play into on how working conditions, the way that work is organized, our relationships, our work culture is also very influential to our mental health and wellness. And so what I have here are just a few stressors, a few factors that I think contribute to our experience of stress, anxiety in the office setting, in the workplace setting. And I want us to bear in mind that even though many of us may work in an office setting, the workspace, working conditions are different. So some of us have sedentary kinds of jobs, some of us have very physical kinds of jobs, some of us pull 12-hour shifts, some of us 8, some of us are more flexible and we work around depending on what times we need to be more active. And it's different for everybody. But there's some general things that we have to consider, and that's the fact that work is going to be stressful in its own way, no matter what you're doing. Some types of jobs are prone to being more stressful than others. So there's more risk for harm, whether that's physical harm or harm to your mental health and wellness. But generally speaking, we all have stressors that are tied to our responsibilities, tied to our home factors, tied to our ability to socialize, tied to our need and desire for support, tied to the way that we treat ourselves physically. So having enough exercise, having enough rest, eating well, balanced diet, drinking water, keeping positive kinds of energy and environment around us. And so there are a number of things that can influence our mental health and wellness. And I wanted us to think about that in terms of some of the themes we've been talking about during this conference. We've talked a lot about, and we will continue to talk about, issues around drug and alcohol use, injury prevention, depression, suicide, trauma. And I generally don't like to divorce our socioeconomic factors or our work life from those issues. They're all combination things. We're holistically one person, but there's so many different aspects of our life that will affect us. And I mentioned that we spend so much time at work because I wanted to make sure that I bring out the fact that work is a big part of what we do in terms of the amount of time that we spend in it. And we spend doing hopefully what we love. Hopefully some of us, most of us will get to do what we love, but generally speaking, some of us don't. Even as we think about mental health and wellness for adolescents and young people, we can think about the fact that some of the issues that they have are also tied to their parents' socioeconomic status, their parents' ability to be in the homes with them, how much time they spend with them, how much time they spend at work, stressors around having responsibilities that are tied to bills and those kinds of things are factors that do affect our young people, even in society in Guyana, in homes and communities. So there are factors that are all tied to work and organization that affect our mental health and wellness. And I didn't want to divorce those, and I didn't want to separate those from when we talk about mental health in the workplace. So I had a couple of things here, and I'm happy that Megan, focused on EAPs, because that's, that I think that's one big part of what we can do to support mental health and wellness. These are some things because I think, our personal health and wellness starts with us. So just kind of being aware, taking care of ourselves, exercising, self-regulation, and those kinds of things. But apart from that, I also wanted to focus on the fact that there are things that our work or jobs can be doing to ensure that we have a better work-life balance, to ensure that we have practices that are informed by good policy, should we have flexibility, resources that we need on the job, to ensure that our job is designed structurally, physically, collaboratively in a way that is helpful to us. As I mentioned, there are some things that are not necessarily preventative. So Megan tied in EAPs, and so that's something that workplaces can do on a secondary or tertiary level of intervention. So thinking about having access to consultations for mental health, thinking about having counseling services available, thinking about having support services for training and resilience building, coping mechanisms are all very important aspects.
I think your sound went out for a second, Kara. So your sound went out for a second. Yeah, I think
Of organization and of what our organization can do to support our mental. Really quickly,
so. Kara, I think your sound went out again.
can you still hear me?
Yeah, I can hear you now.
Yes.
Mhm.
Okay, so sorry about that.
Oh, it's okay.
So
Yeah, I
sorry
think
about that.
it says your network bandwidth is low.
Yeah, let me go ahead and share again. Yeah, so
Okay.
I was I was just gonna wrap up by going to talk a little bit about policy, because I feel like it's really important for Guyana to focus on some other things that we can do to improve our from a policy standpoint, what we're doing to support our employees. From some research that I did, what I found is that what we do have that's available on a policy level is tied to making sure that we salary, benefits, and wages, unionism, and collective bargaining. But if we look at policy internationally, I've looked at policy relating to the UK and the European Union. You'll see that their policy covers issues that are related to diversity, inclusion, equity, gender equality, data protection, practices around fairness and worker treatment, working conditions, collective bargaining. So if you compare what we have currently on the legislative and policy level in Guyana, there's still a long way for us to go in terms of developing policy that is supportive of good practices for mental health and well-being that are not divorced from the workplace. So we do have a mental health act, but in that mental health act, it just ties in really general things about mental health and wellness, and it doesn't focus on anything related to the responsibility of organizations or institutions for their workers' health and wellness. So Megan in her presentation tied in the fact that employees are able to benefit from an employee assistance program at no cost to them. But here in Guyana, employees have their own responsibility, their personal responsibility for their mental health and wellness. So if they need to see a psychologist or a psychiatrist, that is at a cost to them unless they visit a public institution like the Guyana Public Hospital and their mental health unit to access free services. So those are some of the issues that we are still, working around here in Guyana, and those are some of the things that I wanted to mention. So thank you.
Yeah, I think like what is coming through, and I've noticed this in a couple different talks today, is there's a lot of discussion about how we don't live in a bubble. We live in a context. And there's all these contextual factors, whether it be work or school or just, other factors outside of that, determining all sorts of stressors in our lives that could be related to our mental health. So I think that the workplace is one context where that can be a source of either, it could be a source of resilience because you got a lot out of your job, you have a great experience there, you have a very strong identity connected with it. So you have a good social network there. So it can be a source of resilience, or it can be another stressor in your life. So there's all these contextual factors that with policy, with some sort of structure in place to support individuals, we could potentially impact mental health in that way. There's going to see a therapist, but then there's also these preventative things, building these structures in place to make sure that we're taking care of people and that we're being supportive to them. And I hope that employers in Guyana and across the world realize that having an employee struggling with mental health issues is not what you want, because it doesn't help you be productive. It's not utilizing your resources correctly. It is a cyclical relationship. So supporting your employees is in the end important, because it helps you be productive and, you know, help keep your business growing. So.
Yeah, and I think that's a part of the problem, that in Guyana, organizations don't generally look at factors that are tied to mental health and wellness, and the fact that, okay, so for example, if you wanted to take a sick day, that needs to be tied to your physical health. But there are people who will take a sick day regardless because they just don't feel like going to work today. They don't feel well. And organizations don't tend to take into consideration here in Guyana the fact that if you're not so very supportive of your employees, if you're not doing things to create a healthy working environment, good working conditions, then you are going to have issues that are tied to low productivity, that are tied to absenteeism, high turnover rates, and those kinds of things. And that's something that we neglect to take into consideration here in Guyana. We just feel like being industrious is a very big part of what we do. So you have a job to make money, and you're expected to just be committed to that job regardless of, you know, what that job puts into you. There are some organizations that will try to cater to their employees a little bit more, but they consider that there are financial implications for them, and so especially if it's a private organization, they'll pull back on that. So more of the public organizations, semi-autonomous organizations, are going to think about, you know, how they can support their employees, and they'll be more likely to have training in comparison to private organizations, where their training is going to be focused on building work capacity, making sure that you know how to do your job well. So that's not going to be on building things like coping skills, resilience mechanisms, reducing stress, time management, resource management. It's not going to be focused on that. So I think that's really just generally a part of how organizations see the issues tied to mental health in the workplace. But why I specifically wanted to speak about policy, because I feel like that is a place that we can start from on a national level to signal to organizations that this is important, this is your responsibility. Yes, people have stressors that are not only tied to work. So I'm not blaming work for people's stress altogether. I'm just saying that it influences, you know, issues that are tied to depression and drug use, alcohol use, and those kinds of things that ultimately will lead to accidents and those things. So we have high incidences of road accidents and those kinds of things. They're tied to people who drink on the weekends and in the evenings and those kinds of things. So I had one instance that I wanted to share. I don't do it very often, but I had to come out today. I wasn't supposed to be on the road because I have some issues with my car. So I was in a taxi the other day, and the driver was sharing with me, I don't know why he felt so inclined to, but taxi drivers here generally do feel the need to share things. So he was sharing with me that he will work all week and everything will be fine. He could make $70,000 a week, and then on the weekend, on Sundays in particular, he has to go out and drink, and he goes out to drink with his friends, and he ends up spending out all of the money that he's made during that week. And I go, that's insane, that's crazy, why would you do that? And he says he doesn't know, he has to do it, he can't help it. He just feels on the weekend there's something that he needs to do to relieve the stress that happens to him during the week. And it really feels like a bad cycle for him, but he doesn't know how to deal with that, how to improve that situation. He feels that he has to do that. He has to consume alcohol on the weekend to help him to cater and cope with some of the things that are happening to him during the week. We can try to think about that in a bunch of different ways. I mean, somebody who's a psychologist or a psychiatrist might think, yeah, probably he has, you know, issues with alcohol use and alcoholism. We can think about it in terms of stress factors, home life factors, just, you know, having that opportunity to be out. But obviously it's a very damaging behavior that also affects his ability to be responsible, to pay bills, to take care of his family. And that's not a one-off instance or occurrence here in Guyana. That is scenario and stories that you will hear if you go across the board and you talk to men in particular. I'm not excluding women, but men in particular who have high responsibilities in the home. And those things are also tied to occurrences and issues that are related to domestic violence as well. So I just wanted to include that scenario.
Well, maybe I can add from a psychiatric perspective that having a diverse workforce would also include some representation of what the organization is trying to do within a community. So this is also on a level, societal level. It might add to social responsiveness of organizations towards a better mental health state of the country or the city or the environment and context they are in.
Yeah.
So this goes immediately also to culture. What would you like to have within the culture of your organization that can include people that are different and have either mental health issues or other issues that might impact the way that they work, but also the way that they live their lives outside of the organization that they work at. So I think that is, as Kara is discussing the more policy issues, this would also be something that in Europe, there's a large movement towards inclusive workplaces where neurodiverse people, people with mental health conditions, with other conditions, could be diabetes, could be, are included so that they are more of a realistic representation of what is in society.
Yeah. And the workplace should be structured to be supportive of those people.
Exactly.
As well.
Yes.
Yeah. And it's beneficial for everyone if the workplace is supportive. And I think that a lot of organizations don't tend to think that way, like Kara was saying, but I think it is really important for your bottom line to make sure that you're investing and that you're taking care of the people that are your resources. So, yeah. So, unless you guys, Kara and Inga, do you have any final comments? I was going to open up for questions if you do not.
Yeah, I think you could go ahead and open up for questions and comments.
Yeah, that's right.
Does anyone have a question? Oh, okay. I don't know that I have a microphone over. You could come slide next to me. Okay. So from the audience, comments.
All right, good morning. Yeah, good morning. Can everybody hear me?
Yes.
Yes.
Okay, so I have a question for Kara. So I realize within my working environment that a lot of the persons are stressed. So I decided to carry out a little exercise as to find out why. But within that exercise, I noticed people shared, but majority of the persons had this, oh, stop, I'm fine. This type of push off is kind of like a denial something. So I wanted to know if my approach was wrong or what did I miss? Because how do I formulate these exercises in order to relieve stress and to be able to have the work production to be better without coming off as if I'm trying to therapize my workmates?
Thank you so much for that question. So first of all, I have to commend you because I feel like a lot of organizations don't tend to take that standpoint of research before they go into intervention. So they just feel like, we need to do something. So we'll just find something to do that we think is going to be supportive to employees, which defeats the purpose if you don't really know what's happening with your employees, whether that's something in the work culture, whether it is tied to stress and wellness, whether it's tied to building a result. You don't know what it is until you ask. As soon as you were talking, the first thing I would have asked was, what your approach might be, because I think surrounding issues that we feel are tied to our mental health, as we talked about earlier, there is still a lot of stigma. So if people feel like they cannot report what's happening to them discreetly, this will affect what they say and how they say it and how much they say. It also has to do with the level of comfort for that person who's doing the research. So if you are somebody that they're comfortable with, then it's easier to go in and do more of a qualitative kind of data collection where you actually talk with them and get their feedback on those kinds of things. But Guyana, as I mentioned, I think, in my opinion, tends to have this working environment or a general culture where industry is important. So if you feel like there's anything that might be a threat to your job, you don't want to complain about it and say, oh, I hate this job. You'll go talk to your friend about that. You'll talk to your colleague about it. You'll talk to your family about it. But you don't want to talk to somebody at work about that, especially somebody in HR, because they're responsible for hiring and firing, and you don't want any issues that will compromise your ability to actually have stable income. So you do have to be very careful with what your approach is. It does depend on what your work culture looks like, but I always encourage organizations to do the research first, engage in some kind of evaluative method before you go into thinking about what the intervention is. And I'm happy that you are vigilant and aware to see you do feel like people are stressed. And as I mentioned, no matter what job you do, even if you have a sedentary job where you sit down behind a computer every day, there are stressful factors that are going to be tied to your mental and physical health that affects. So it's not necessarily something that we can avoid. It's really just about how we internalize it, how we treat it, how people process that stress, how they deal with it, how they offset and try to balance that. So I'm happy that you noticed that and that you went in to do some research. But yes, I would encourage you to be cautious and careful and sensitive about your approach, because it is still a very taboo thing to talk about issues related to stress and mental health and mental illness in the workplace. Because mental health is a positive thing, but when we say mental health, we automatically think mental illness. So I like to separate the way that I frame those two things. But I really commend you, and I want to encourage anybody else who's listening to always start from a place of research when you're thinking about what interventions could help support employees in your work organization.
All right, thank you. You also
Thanks.
You spoke about policy. Now, within the Guyana's public service, we know that mental illness is prevalent. What systems do we have in place in terms of them having access to therapists, psychologists, being able to have like an evaluation done, whether it be if they need it every 3 weeks, every month, every 2 months, what systems do we have in place? Because what I found is within some of these questionings of my workmates, just asking them, how are you doing today? How do you feel? You find that there's a level of them having issues that I'm not a qualified psychologist, but I'm studying, but I would not be able to input as much as a psychologist would do. How do you get them to accept the fact that, okay, talking to someone would be good? And two, what access do they have to these things within the public service? Because we know we have the Georgetown Psychiatric department, but as soon as I say that, people are like, okay, never mind, it's cool, it's fine. I don't want to do this anymore. So how do we get people to actually take advantage of the things they have available?
Yeah, you're absolutely correct. And again, that's tied to the stigma. So if I tell people that that's an option for them, you can visit the mental health unit at GPHC. They go, okay, well, it's free, and for some people free is good because they can't afford to foot the bill for their sessions. So some people will consider it, but most people, especially people in the workforce, will feel like they don't feel comfortable going to some place that's not public. You walk in there, automatically there might be issues around, well, you're thinking in your mind that there might be issues. Oh, people see me going in there, they'll automatically assume something is wrong with me. And so there are some very cultural issues that are tied there that prevent people from wanting to access the health services, the mental health services that are available to them through the public facilities. So it's a difficult trade-off to convince people to do that. There are persons who are in private practice that I tend to recommend, depending on how cases come to me. I'll recommend somebody who's in private practice, but again, that is, whether that person can afford that kind of service. There are, as far as I'm aware, I don't know of any organizations that actually do have a structure. I always push for that. I say it, organizations still don't see the importance of investing in it, but it is a good place to start to ensure that there's a structured approach to making sure that your employees have access to treatment, to healthcare. At the University of Guyana, we do have a counseling unit. They cater to both staff and students. It's a very small unit. It definitely needs expansion. It's something that we're working on. And we do have a couple of policies that we've worked on that involving inclusion and mental health. And I think that we are, I'm not boasting or bragging or anything, but I think that we are setting a good standard for some things that could be adopted nationally, and I don't want to say imposed, but something that we can share, so that organizations also tend to pick up this responsibility of having access to services that are available to them, to their employees. For University of Guyana, we have to think about both staff and students, and so our there's a wider coverage area. But again, there are always going to be issues tied to whether that person wants to access it, how they feel about it, whether they feel like it's necessary. And some people tend not to, even with our physical health, some people tend not to go to the hospital until it is a dire situation, until they feel like, okay, well, I definitely need to go now. And it's the same thing with our mental health. We ignore it, we stay home one day, we stay home 2 days because we don't feel like it. We don't feel the energy, we feel, we don't want to do things, we don't want to be involved in activities. And then until it comes to a point where it really affects our functioning, then we realize, I need help, I need support, I need it right away, I need to be fixed. And you want that to happen immediately as well. So I think there are always some personal things that are going to be tied to how people access services. Private services are available, but you still have to be willing to access that treatment. And it's not necessarily a matter of convincing people, so to speak, because I feel like it's an individual decision to make, but it is a matter of, on a community level, on a local and national level, as well as on a regional level, to work on destigmatizing mental illnesses and issues surrounding mental health and wellness. We don't think about stress, something as simple as stress, as being a mental illness, and it's not necessarily a mental illness, but we hear stress and we feel like, oh, something might be wrong with us psychologically, and we don't want to go to a counselor for it. But you can go to a counselor for anything, whether it's tied to your goal setting, whether it's tied to your achievement, whether it's tied to anything that you just want to talk through with somebody. It doesn't have to necessarily mean that you have a mental disorder or a mental issue, but going to a doctor, a psychologist or a psychiatrist has stigma attached to it that I think we need to work on destigmatizing, which will help those persons who are mindful of how it will look to want to access those services and to think about the benefits to themselves and to their personal growth and development.
Thank you. Thank you so much. So thank you so much to Inga and to Kara. This was a really wonderful discussion. I'm really happy to have been part of it. So thank you very much.